Here's a cute pup. Thanks for clicking on this video and stay safe. Doctors of Reddit, what was the most incorrect self-diagnosis you've encountered in your practice? I'm interested in hearing about how off-base patients are when they are in denial or Google their symptoms on the internet. What was the patient's self-diagnosis? How did they come to that conclusion? And what was the actual issue? This happened in med school. I was taking the history of a guy in clinic, and I asked about his past medical problems, including if he had had any heart attacks. He responded, "Oh yeah, I've had about 20 of those." "You've had 20 heart attacks?" "Yup." "Which doctor or doctors did you see about them?" "Do you have a cardiologist?" "Nah, I never went to a doctor. My wife is a massage therapist, and whenever a heart attack hits, she starts to massage some pressure points and it stops." Okay. What does it feel like when you have a heart attack?" "I don't ever remember them. My wife tells me that I fall onto the floor and my arms and legs start jerking. She says it takes about a minute of her massaging before it stops. I then get really confused and tired afterwards, and I can't remember much of anything that happens to me until I take a nice long nap." The dude was having seizures and thought that they were heart attacks. They normally stop on their own after a few minutes, at the most, and his wife thought that her massages were curing him. I've had a patient claim that amputations run in his family. He said that was the only reason he needed both legs taken off above the knee. He was adamant that it was not actually due to his uncontrolled diabetes, his enormous and continual sugar intake, his refusal to use insulin, or his refusal of treatment for the giant infected wounds on both feet. Sounds like nothing runs in his family. How the hell does someone think getting body parts cut off is genetic? I don't know. I've heard that death is genetic in my family. After a certain age you just kind of die. Scientists recently discovered children are genetic. If your parents didn't have any, chances are you won't either. 15-year-old boy brought by ambulance from the movie theater thinking he was having an allergic reaction to breath spray. Turns out he had an anxiety attack anticipating his first kiss. That one made me happy. Hope he got his kiss and can laugh about it now. I also want to add my favorite correct patient diagnosis. A female doc I know at my school likes to tell this story as an example of why one must always ask for patient attribution. That is, what do you think is causing your problem? Really old guy came in complaining of foot pain. He was diabetic. Lady doc already has a diagnosis in mind, but goes through the whole shebang. At the end asks, "And what do you think is causing the problem?" He goes, "I think I have a tack in my shoe." He had a tack in his shoe and couldn't bend over to get it out. She helped him remove it and he went on his way. Veterinarian here. Hope you won't find this out of place. I had a client come in several years ago with a dog suffering from flea allergy dermatitis. These dogs have an allergy to flea saliva that causes them to get insanely itchy, primarily around the rear end and base of the tail. This poor little guy had chewed his fur out to the point that his back half was just about completely naked. So there he sits scratching and biting at himself, covered in fleas, several of which I have combed off of him and showed his owner. Good news, I say. We can fix this. After explaining the diagnosis, his owner proceeded to tell me how foolish I was. The dog was not itchy because of fleas. He was chewing at himself as a psychological response to the disturbance caused by having his butt shaved by an unknown intruder who must have broken into the house while they were away. I had no response to that other than to agree that, yes, that must have been very traumatic for him. Ultimately we agreed to treat for the fleas, just in case. Shockingly, the dog got better. So I'm a therapist, and I work with kids. Worst misdiagnosis was a family with a 2-week-old who was convinced the baby had 1. Anxiety because he cries. 2. Autism, little eye contact. 3. Bipolar disorder, because baby would seem content then angry. I spent hours explaining child development, what these diagnoses mean, how they would present in kids. I provided them with books, handouts, etc. They insisted on going to see my co-worker and a psychiatrist as I was surely lying to them. Even after meeting with the other 2 professionals, they still weren't convinced. They requested psych meds from the doctor. Lady came to the clinic with her 8-month-old baby and she was pretty freaked out. Her baby had diarrhea for the last few weeks and wasn't going away. She initially wasn't concerned, but then her friend told her that diarrhea is the first sign of AIDS and now she was convinced her baby contracted AIDS. We quickly ruled that out through their med records and assured her that her baby didn't contract AIDS randomly. As we finished examining the baby, it started to cry, so we handed it to her mother. Lo and behold, she pulls out a baby bottle to get the baby to stop crying. Only this baby bottle is red and is filled with Kool-Aid. We had to explain to her that babies can't handle sugar at that age and that was the cause of the diarrhea. She refused to believe what we said. I was raised on Kool-Aid and look at me, I'm fine. Man, the south side of Chicago is a completely different world. Edit. Another story from that clinic. A lady came in and after she got off the scale she asked what her weight was at. She 10 pounds heavier than the previous visit and seemed upset. So I asked her what about her weight was bothering her. She said she was trying to lose weight, but it didn't seem like her diet was working. I casually asked what her diet was, thinking she was trying some of the new diets. Her answer was bacon. Her friend told her that if she added bacon to all her meals she'd lose weight, so she had been eating bacon 4 to 5 times per day for the last month. She was shocked when she learned that she was doing the exact opposite of what she was supposed to do. As a self-diagnosing patient, one day notice a white hard jagged object protruding from my back gum. Can't believe I'm having a tooth come in, especially since I'm 23 and had my wisdom teeth taken out years ago. Go to the dentist to get some x-rays and it turns out to be a piece of a tortilla chip. I'm sorry you had Doritos, it's fatal. Just finished med school, so not too much experience, but had an elderly woman come in the ER with new onset seizure. The patient's daughter was convinced her mother had a brain tumor. On review of the medications, turns out the patient had been out of her Xanax prescription for 4 days and had a withdrawal seizure. Oh god, withdrawals. If I didn't know what withdrawal was, I probably would have thought I was dying when I went off some of my medication. I still think I'm dying when I get off my medication. A patient came in with what he thought was a rash and the flu. He ended up having necrotizing fasciitis and was dead by the next day. Edit. Necrotizing fasciitis is pretty much flesh-eating bacteria. WebMD might have actually gotten this one right. I had a male patient come into the ED complaining of breast lump. He anxiously stated that the mass was very painful to touch and was convinced that he was going to die of breast cancer. After a battery of questions I asked him to take off his shirt so I can examine and palpate, read, touch the mass. After a couple of seconds, I turned to him and said, "Sir, that lump is your rib." He called me a dumb kid and asked to see my attending. I was a student at the time. The patient asked the attending why, if it is a rib, that it would hurt so much. The doc replied, "Sir, you've been rubbing and irritating the area for days now. You've been hurting yourself. I've never seen a man leave the hospital that fast. The number of times I've done that is ridiculous." My most embarrassing breast cancer scare, though, is when I went to the doctor because one breast seemed lumpy and way bigger than the other. Turns out my breasts are just lopsided. He wrote it on the chart. It hurt my feelings. I'm so sorry, but this cracked me up. I can just picture him licking his pen and then writing on his chart while saying out loud lop-sided breasts as you look on in horror. You've just got a lazy tit. We'll put a patch over the other one and it should perk up in a few weeks. Patient is diagnosed with invasive ductal carcinoma of the breast, confirmed with biopsy. Surgery prepped for 2 weeks time. Patient goes to an outside facility and does a mammogram. Radiologist Red states it is benign. Patient writes an email to her primary doctor, "My attending, prayer works. Please find attached report stating I no longer have breast cancer. Please tell Dr. X, surgeon, that I will be no longer needing surgery." Q furious emails to surgeon with sense of impending doom. TLDR, mammograms don't pick up everything. Edit to at, sorry there is no resolution at this time. This happened last week. The patient's surgeon is now in charge of counseling her to change her mind. Double edit 2 weeks later, patient has been convinced to get the surgery. Seizures from a parasite. He was actually psychotic and was self-treating what he thought was a parasite infestation by drinking household cleaning agents. When he started seizing afterwards, this reconfirmed his parasite diagnosis in his mind, so he drank more. Damn it. If you are going to drink household items to clean your body of something, just use some vodka. Source: I'm Russian. Had a 19-year-old girl come in asking for antifungal medication because she was convinced she had oral thrush. Her and her boyfriend had googled her symptoms, and at 19 you're never wrong. When I suggested that perhaps we check an EBV antibody to rule out mono, she looked at me like I was actively drooling on myself and refused, because there was no way I can have mono. Eventually I convinced her to have some diagnostic testing done, and sure enough she had mono. I tried to explain that having oral thrush as a 19-year-old could possibly be much more concerning than mononucleosis, but she didn't seem to get it. I was the person self-diagnosing. I thought I had a really bad muscle spasm. I actually had cancer. Oopsie. My husband had a really bad sinus infection. 10 days of antibiotics and still not feeling any better at all. Went back to the doctor and they put him in the hospital because they thought he had mono. Turns out next day, leukemia. Thank goodness they called another doctor to come in and look at his actual blood work. Man came into the ER in a panic thinking he had incurable skin cancer. Turns out he had a wart on his foot. Self-diagnosis? I'm an orthopedic surgeon, so patients are really often unable to diagnose themselves because they don't have the power of MRI or scoping. The most incorrect self-diagnosis I've encountered was a patient who believed they broke their hip after a fall when they actually had a 2-inch piece of skateboard lodged into their side they forgot about. Yeah. Hey, that's where I put it. Thanks doc. While working as a nurse, had a patient who insisted that her abdominal pain was from a surgery she'd had done on her arm. She thought that a staple that had been used to close a wound on her arm had somehow traveled to her abdomen. Anal cysts? Nope, he just touched his anal cavity too much and left it irritated. He was just checking for anal cysts every day. This is only tangentially related to the topic at hand, but gave me great joy at the time, so I thought I'd share. During my time as an intern, a patient was admitted for anemia, hematocrit of 16, requiring blood transfusions. Turns out that at some point in the past, after she was diagnosed with an inborn error of metabolism, her primary care physician prescribed her vitamin B12 injections. Your body requires B12 to make hemoglobin, instead of going back for refills. After she ran out, however, she headed over to her local pharmacy, bought vitamin B6 tablets, and proceeded to take 2 per day, and went on to explain how, you know doc, it's the same thing. Yeah, no. Silly woman, everyone knows 2 B6 pills make BB12, not B12. One time I had a patient tell me he gets nervous on airplanes just to get some Xanax, as long as he doesn't pee too often. Not exactly a misdiagnosis, but my favorite misunderstanding. My dad worked as an ER doc for 30 years and started practicing in Alabama way back. He said he had a lot of illiterate and uneducated patients. He was taking one woman's medical history on a visit, and she told him she had fireballs of the Eucharist. Translation: fibroids of the uterus. If going to church allowed you to cast fireballs of the Eucharist, I might consider going. Not a doctor, but my PCP told me that I had a sinus infection when I actually needed a heart transplant. Got my transplant 3 years later. Doing great now. My boyfriend's friend's dad went into urgent care with severe chest pain. Doctor takes one look at him and writes it off as bronchitis without any tests. Later that night, he died in his sleep from a heart attack. His wife sued the hell out of that doctor. For those of you asking, his wife did win the lawsuit. I don't know how much money she received, but I do know the doctor's license was revoked.